Hey, future nurses, are you stressed about getting your license? Here at Remar Review, we believe in faith over fear. I'm Regina, the #1 NCLEX instructor in the world. Tune in to Remar Nurse Radio on Spotify and Apple Podcasts for new episodes every Thursday. We got that exclusive content. You don't want to miss it. We can, we will, we must pass NCLEX. Come on in. It is time for our favorite programming here, Remar Review. This is Let's Talk NCLEX / Monday Motivation, but we're going to be talking about pharmacology today. So I hope that you are ready to get your studying off to the best start you can at the beginning of the week. Again, my name is Regina. If you've never been here before, welcome. I'm so happy that you're here to study. Let's do these NCLEX questions. I am the #1 NCLEX instructor on the planet, and I'm so happy to be here with Remar Review. Let's go. A client has been prescribed Propylthiouracil or PTU. Which of the following statements should be included in the client's education? Again, right here, we're talking about pharmacology for today. We're looking at Propylthiouracil. What should be included in the client's education? Number 1, this medication will be taken for the rest of your life. 2, this medication should be taken with meals. 3, this medication will take effect within the first few weeks. Or 4, this medication is best used in clients less than 250 pounds. Come on in, write your comment, share this video. We are getting started. Hey, thanks, Violet, for coming back and saying you passed your NCLEX RN. This is what we do here at Remar Review. We study, we work hard, we get over anxiety and fears, and we pass NCLEX. A lot of people are saying the answer is number 1. A lot of people are convinced the answer is number 1. I'd like to tell you what the answer is. Here we go. The correct answer, you guessed it. It is, it is actually number 3. It is actually number 3. Surprise! I'm challenging you guys today. Propylthiouracil, number 3. This medication will take effect within the first few weeks. The medication will be most effective when all of the thyroxine hormone has been depleted, which may take days to weeks. So the medication's absorption rate is not affected by food at all. So it doesn't have to be taken with meals. The length of the treatment is not guaranteed to be lifelong. You don't take PTU for the rest of your life. You don't. You take it in relation to the disease process and the severity of the disease. Right? And then the client's weight is not a determining factor on the effectiveness of this medication. I just made that up as an item choice for you guys. So, hey, guess what? You are here studying NCLEX questions, and the idea is that you learn something new. So if you've learned something new, then you're already winning today, right? So Propylthiouracil, you may know what it's for, but how long do you take it? Well, it takes weeks in order for you to work, but you don't have to. You don't have to be on it for the rest of your life. How do you guys feel about that? Okay. Hey, Stephanie says she passed her NCLEX thanks to the #1 NCLEX instructor on the planet. Let's try another one, shall we? Let's try another one. I'm so happy that you guys are here. Good morning, good afternoon, good evening, wherever you are from. You are in the right place. All right. Don't forget Monday Motivation. Our topic for today is after you make the right decision, what are you supposed to do? That's called the follow through. So we're going to talk about it. Here we go. What is next? Oh, let me tell you, guys, you know how we love this time of year. Well, we have a live NCLEX review coming up for Black Friday. Black Friday is at the end of this month. You don't want to miss this live NCLEX review. It is literally going to be an hours long free NCLEX review for you. So if you are here and honestly, if you guys have invested in yourself and you have purchased the DVD self-study package, the Black Friday review will be perfect for you because it will be an intensive review with me before you test. So, hey, we have Black Friday. I want you to sign up for it right now. I want you guys to sign up for it. You don't want to miss it. It will be the Friday after Thanksgiving. Let's do question number 2. Question number 2. Welcome all the new watchers here. We're happy to have you. A nurse is caring for a client with diabetes insipidus. Which medication should he prepare to administer? Pharmacology today. Client with diabetes insipidus, which medication do we give for that? Is it number 1, vasopressin, 2, furosemide, 3, regular insulin, 4, intravenous fluids, or 5% dextrose? What are we going to give for the client with diabetes insipidus? What are we going to give for that client? What say it, you guys? Okay. Go ahead and give a good answer. Give your best answer. And don't worry, we'll go over it in the end. Okay. So the correct answer is going to be number 1. Yes, that is correct. Vasopressin, for everybody that picked it. Because remember, with vasopressin, there is a decrease. Remember, there is a decrease in the antidiuretic hormone in the body. And the antidiuretic hormone does what? What is the purpose of the ADH hormone? I know you guys remember this. The purpose of the hormone is to tell the body to absorb or hold on or to retain water. That's what anti-diuretic means. So if you think about diuretic, means to release water, get rid of it. If something is anti, it's going to tell the body to, hey, hold on to the water. There's no water leaving here. So you have a decreased antidiuretic hormone. You need a medication that is also going to tell the body, hold on to water, retain water. And so that's what vasopressin will do for our clients. Vasopressin will do that for our clients. Okay. Are you learning today? Are you seeking wisdom? Are you seeking knowledge? And are you understanding why the correct answer is the correct answer? So if somebody with diabetes insipidus, they have a problem with releasing too much fluid. All right. So they have dehydration is the main staple, one of the clinical indicators of the diabetes insipidus getting worse or progressing. So number 2 says furosemide. Well, we would never want to give a diuretic. Okay. You guys may see this on your NCLEX exam. You don't want to give a diuretic to somebody with diabetes insipidus. Never want to do that. Okay. And then, you have no reason to give insulin. But for students who have not studied diabetes insipidus, they think that this is related to a glucose problem, insulin intolerance. And so if you haven't studied diabetes insipidus, you'll think this person has an issue with hyperglycemia. And so you can always expect to find insulin as a possible treatment for diabetes insipidus. It is a big distractor, and it is a very good one because students fall for it all the time. And so if you think that regular insulin or any kind of insulin, intermediate insulin, if you think that is a treatment for diabetes insipidus, it shows that you won't be a safe nurse. And so it's very important to understand the reasons behind the names of diseases. Okay. So don't just think diabetes and think of hyperglycemia, because that's not always the case at all. Now, intravenous fluids and 5% dextrose, you would give an IV fluid for somebody with diabetes insipidus because, again, they're constantly losing water. They're constantly losing water, but that is not going to counteract the condition. So you can give somebody with diabetes insipidus IV fluid, and that's going to prevent them from becoming so dehydrated. But the issue is a lack of the antidiuretic hormone. So you want to fix the problem, not just treat the symptoms. So with NCLEX, it is really about thinking, what is the best choice for my patient? Because the choices are all going to look good, but what is going to correct the issue? Or what do I need to suggest to the physician? Because nurses are at the front line. And so we have to be able to understand out of a list of medications what's going to work best. Okay, we are moving on. Let's do the next question. Pharmacology here today. The nurse is caring for a 26-year-old female client who is scheduled to receive a beta agonist. Before administration of this medication, which assessment finding would most concern the nurse? Which assessment finding would most concern the nurse? We have number 1, a respiratory rate of 27 breaths per minute. 2, a heart rate of 115 beats per minute. 3, a blood pressure of 100/60 mercury, right, per milligrams. We have a pulse oximetry reading of 92%. We're talking about a nurse is about to give a beta agonist. Oh my goodness. Okay. Which assessment finding is going to be most concerning to the nurse? Which assessment finding is going to be most concerning to that nurse? And this is basic pharmacology, really fundamental. Okay. And I just kind of want to know where you guys are at in this subject. Where do you need the support at? And you, as we're doing this, I want you to take note of how you feel right now. Are you getting kind of anxious about this topic, seeing the questions? Are you thinking to yourself, oh my goodness, what is a beta agonist? What does that even mean, right? A lot of pharmacology questions are really not about the medication name. They are about the class of the medication, right? It's not even about you memorizing a list of drug names. It's, do you understand how a class of medication works? So some students say, on NCLEX, I saw medications I'd never seen before. I saw information I'd never seen before. Yes, that's the point. All right. There was something in that question. There's something in that question that helps guide you to the correct answer. And it has nothing to do with the generic name. Most of the time, it is the class of the medication. And so really looking at this one, it's very simple. Okay. Really looking at this one is very simple because you don't even have a distractor of a medication name. It gives you the function of the medication. Okay. So the correct answer based off of what we have right in front of us is item number 2. Okay. Item number 2, a heart rate of 115 beats per minute. Okay. This is irregular. And particularly when you talk about a beta agonist, it is going to stimulate the heart. And so if our client already is tachycardic, if they're already experiencing, I guess it's sinus tachycardia, maybe we can assume that, we shouldn't. But if they're already having a tachycardic situation, we give them this beta agonist, it could really cause them to convert to an even more serious irregular rhythm. So we're talking about here the functions of medications. Good job, you guys that got it. We're talking about here how a medication class can help guide you to the correct answer. Yeah. Because if you knew what a beta agonist was, well, then you already were going to be looking at, is it between 1 or is it between 2, right? Is it between 1 or is it between 2? Okay. And so that heart rate is going to be the most concern for the nurse. Okay. All right. Okay. So don't worry about it. Just getting on. All right. If you're doing great, awesome. If you're just joining us, we are doing Let's Talk NCLEX. We do this every Monday. We come together. Our topic for today is pharmacology. And I love it because it's really challenging us today to really get into, okay, do we know what we're supposed to know? All right. And we're just going to do this for a little bit longer. And we're going to transition to our motivation. All right. Some people are going to need some motivation after this. All right. Let's go. Okay. A client with a moderate level of anxiety is having an episode during her afternoon therapy session. Which medication would the psychiatrist most likely prescribe? Number 1 says alprazolam. 2 is escitalopram. 3 is fluoxetine. 4 is sertraline. Okay. So out of these 4 medications, I'm gonna let you guys have at it. Which one is going to be the most likely psychiatric medication that is appropriate for the condition? Okay. Hey, and so what you're thinking now is, number 1, do I know the condition that the patient has? What type of patient is this? This is a patient with anxiety. Do I understand what anxiety means? Do I understand the symptoms of anxiety? Let's start there. Okay. All right. And then when you get down to the medications, can I identify these medications? Can I, in my mind, think of a clinical scenario where each one of these medications would be appropriate? Or can I think of even a diagnosis that may go with them? Or can I think of a class? What class? Can I look at the beginning? Can I look at the ending and try to come up with what the action of this medication is? Okay, because I'm only looking for medications that I can use for anxiety. Okay. All right. So. I'm going to reveal the right answer. I see the options on the screen. All right. I see the options on the screen, and this is how you study. This is what it's supposed to look like when you study. This is what it's supposed to feel like when you study. Okay. It's about spending time with the question. The rationale is great. It's great to read rationales, but can you understand the question? Okay. The correct answer is number 1. A lot of people had it. Yeah. Alprazolam is a benzodiazepine. Yes, is a benzodiazepines. Before you take NCLEX, make sure you understand this class benzodiazepine. It is foundational to having, I'm going to say it's foundational to understand all the other classes. I feel like you need to start with the benzodiazepines so that you can understand the difference in the other classes. Benzodiazepines are going to be used to address your general anxiety. Yeah, benzodiazepines are going to be given to relax patients, to calm patients down who maybe even have other conditions, because they're so good at sedative effects. Okay, but there are some reasons that we don't always give benzodiazepines for long periods of time. There are some reasons why benzodiazepines cause other laboratory values to be monitored. So you are responsible. You're responsible for taking time out and learning this information. one of the things that I love about you guys coming here is the accountability. You are creating an environment of accountability for yourself. And I love that. It's not about you just coming here and doing a few questions, getting a few answers, and going on about your day. The process of evaluation should be taking place right now. So the questions that we're going over that are very common and routine. I mean, some people say, Regina, you focus on the fundamentals a lot. Yes, I do. Because if we don't have the fundamentals down, there's no sense of us going to application, critical analysis questions if we struggle with the fundamentals. And to be honest, most of us do. Most people do. When schools contact REMAR and they say we need help, they say we need help in the fundamentals. Our students are not passing exit exams, and it's not because they're not critical thinkers. It's just because they don't have content in the fundamentals, right? So here we're looking at benzodiazepine, and we're looking at its connection to anxiety. Okay, all right. And yes, if you don't know the other classes, if you don't know the other classes, then you can definitely write them down, look it up, or write them down and look it up. Okay. All right. So let's do one more. Let's do one more question. Okay. And I'm going to put it up here. We're talking about pharmacology here today. All right. A medical assistant. Okay, because you guys know sometimes we will be working with medical assistants as nurses. A medical assistant administers aspirin to a child with flu-like symptoms. The child develops Reye syndrome, depending on how you want to say it. Which of the following clinical manifestations should the nurse expect? So you have a child with Reye syndrome. Which of the following clinical manifestations of aspirin being given to a child with flu-like symptoms are you going to expect? Is it number 1, bruises and bleeding, 2, hyperthermia, 3, abdominal pain and diarrhea, 4, anemia and hyperkalemia? What are we saying? What are we thinking for this condition? Okay. And I just want to make a note that some of you guys actually have the REMAR. Some of you guys already have the REMAR review products. And to be honest, a lot of these questions come right from, basically all of the questions, I should say, come right from the package. Okay. So this is a common question about a very serious complication that a medication administration to a child can produce. So a lot of people saying, hey, we are thinking that the child may have number 3. Is it number 3? Is it number 1? What are you guys thinking? What are you resonating with here? All right. Perfect. Okay, you guys are doing very well today. I would say you guys are doing very well from what I'm seeing. So don't be too hard on yourself if you don't get them all right. It's not about getting them all right. It's about learning. I have to keep saying that. So let's, the correct answer here is actually, it's number 1. It's number 1. If you guys think of how, and I'll tell you how you can figure this out very easily. If you guys think of what Reye syndrome attacks, it is the liver, and it is the brain, right? Those are the 2 organs that are affected, the liver and the brain. And how important are these 2 organs? So important. So when you have an issue with your liver, that's going to be bleeding complications already. That is going to be bleeding problems because the liver is so, it's so connected. is so relational to your ability to clot and your clotting factors, right? So clients, children who have problems with their liver, they tend to bruise very easily. Okay, so here they'll have poor blood clotting. So you're going to see bruises, you're going to see nosebleeds, right, in this patient. Hyperthermia, abdominal pain, and diarrhea, anemia, and hyperkalemia are not expected. Okay, and this question was very difficult. This question is very difficult, very, very difficult. If you're not familiar with, the condition. So in the Quick Facts book on page 55 of the Quick Facts book, it says, what is this condition? So Reye syndrome is acute encephalopathy. And that is a brain disease, okay? So it attacks the brain, and then also it says what other organs are involved? The liver and the kidneys, okay? The liver and the kidneys. But the main organs are the brain and the liver, okay? And so it says, what is the cause of this? Viral infections. If you don't have Quick Facts for NCLEX, your life is a lot more difficult than it needs to be. Okay, because I go over all of the topics, all of these content topics that you just need to be familiar with to figure out. I go over it in this book. Okay, so that question directly, my inspiration came from Quick Facts when I wrote that question. Okay, so I want you guys to look at these questions, pharmacology today, and I want you to evaluate, hey, I did really well. I did not so well. So this is what it's about when it comes to studying. And every Monday we do this here. Okay. All right. So I want to get into our motivation here. Motivation. We have a ton of motivation. I see people popping up with testimonials saying how they passed. Congratulations to you, Alice. Alice says, hi, Regina. Hi, Regina. Just coming in. I passed my NCLEX RN. Did it on the first try. Did it on November 1st. That's what she said. Sorry. Thank you so much, Regina, Mark, and the entire Remar family. That's you guys. Be blessed. I'm sticking around. I can't resist studying with you. Oh, my goodness. What a pleasure. All right. Also, I want to shout out Nurse Tomika, got her RN. She says here, I'll let you say it in your own voice. Okay. But essentially, this is her story. This is her video. Check it out.
Hi, my name is Tamika, and I'm here to share with you how Remar helped me. This is the school I went to receive my bachelor's degree, Lakeview College of Nursing. And I just recently started my RN position. So our school required that you use ATI to study for the NCLEX. And then my cousin, he introduced me to Remar. So he gave me these books and stuff, and I started studying. I studied with the Remar books and the DVDs and stuff for about a month or so. So I went in August the 12th to take my NCLEX, and I passed in 78 questions. If you don't have this book, you need to go get it. It's the best thing that ever happened to me, and now I can walk with God into my new career. Thanks, Remar.
Hey, I have to show you. So right now, because I want everybody on here, if you don't have this book, 50% off of the 5-star Quick Facts at remarnurse.com. And we're throwing in the DVD for that book if you purchase it now. I want you guys to get it. And I don't know if you realized it, but it was not the 5-star. It was the original. So the 5-star is the upgraded version. Nurse Tomika, you needed the 5-star, but you didn't need it because you just had Quick Facts. So everybody out there, I'm telling you, this book is the best way to just really evaluate what you know for your exam. the topics in here, the 5-star, you guys know, has the clinical skills. It has the pharmacology. She said her school, made her use ATI. And I know that's very common. You guys, the school, they're making you use, other review programs, and you're coming out, you're not confident, and you know that you need the Remar products to help get you together. So one more time, I got to just say 50% off the 5-star quick facts. If you don't have it, then you definitely need to get it. And it comes with the DVD right now. So remarnurse.com is where you can find it. Go find out, go see. I see people saying, okay, I'm going to get it. I have the original. Do I need the 5-star? Nurse Tamika passed her NCLEX with the original. I always recommend the 5-star because all of the updated information is in there. So you can use the old one that you have, but if you have the opportunity, or if it's a really good sale, like right now, I would get the newer version. And literally, let's see, hi, Regina, I have the original. Do I need to buy the 5-star now? I would say you do. I would say you should get it because, like I said, this has 17 new topics in it. It has your 3-week study calendar. It has the clinical skills section. It has all new questions in the back of it. And so it's really a great resource for you to have. I know that other companies, they put out the same book every year over and over again with 0 changes. And they just call it the 5th edition, 6th edition, 7th edition. With the 5-star, I made sure that I didn't do that. It's definitely a great combination. And somebody asked about the DVD that comes with it. So the DVD that's going to be included is this one here. And with this DVD, it asks you questions from the book. So it's like watching a video of me, or like watching a movie of me asking you questions from the book. So I break it down like the first 20 pages. I'm asking you questions from those topics to see if you know it. So like, hey, what are the symptoms of benign prostate hypertrophy? What is the diet for celiac disease? So the things that are in here is what I'm going over in the DVD. And so we're going to get it, and we'll put a link where you can get it as well on the video. Okay. Also, what's next for Remar? This is an announcement that we had alluded to last week when we talked about the clearance sale that we had, and when we talked about how we were making sure that everyone who wanted the DVDs got an opportunity to get those DVDs. So at the end of this month, we're working on a new program for Remar, and it will be an opportunity for you to study with Remar online. Black Friday is when we will release the products that we have, the program that we're working on to you guys. I'm really excited about the Black Friday NCLEX review, though. If you guys know historically what we do on Black Fridays, that is an all day. That is an amazing review. I go over the most important topics. I literally pull everything from what I've been getting in emails, what people are saying, hey, Regina, I need you to go over this. I pull stuff from Remar Nurse University. And on Black Friday, it is an intensive NCLEX review for literally hours. We're going to go over the entire Quick Facts book. We're going to go over the entire Quick Facts book on Black Friday. Okay. So I need you guys to sign up for it now. Also, I just want to say that everybody who has taken advantage of getting the DVDs, and you guys know the RN DVD package that we had the clearance sale on this weekend, we still have a few of these left. So if you haven't gotten an opportunity to get it, and we dropped it down to $169 from $300 to $169 for the ultimate package. If you guys have gotten this and invested in yourselves, you're literally owners of the material. Okay. And also, you guys know that the PNs are sold out. There will not be any more PN DVDs. So you guys that were able to purchase and secure your PN program, you now have that program. You have that program full life. It is yours. And so what I want to say is that This is such a special package. This is what people are using to pass NCLEX every day. When we come out with a new program, we will not sell these DVDs anymore. There will not be any more DVDs. So that everybody that made the investment this weekend, you guys now have that package. It's yours. It's yours. It's yours. And I won't ever do that again. So just know that you guys made a great investment. For those who got the ultimate package, oh my goodness, this weekend, you got all of these things. You got all of these books. You got the books and the DVDs, and this is yours. So I'm so excited. I'm so proud of you. The student workbook and the activity book, these things now belong to you. So shout out to you guys. Congratulations. Mary says, I did. I'm glad I did. Yeah, I'm glad I did. So the PM package, like I said, they're totally sold out. We don't have any more of them. The RNs, there's still a few available. So shout out to you guys who made that investment. Somebody said, can I buy the one that's in your hand? All right. So how do you sign up for Black Friday? That's an excellent question. Black Friday is where we need to be at. Even if you purchase the program, let's sign up for the Black Friday review, because you will be already weeks into your program, and that Black Friday review will help you right before you test. So everyone who has the DVD package, you have the opportunity to get your license before the year is up. And that's what I want for you. To sign up for the Black Friday review, go to remarnurse.com. Okay. And you will be able to sign up for it, and you're going to get your agenda. We're going to be sending out the workbook. Let's see what else. And you'll just know more information about that. Anything for the teas. Yeah, just really quickly, we'll have, we also do teas preparation. So I don't have the book in here, but the quick facts for teas, also Black Friday, that will also be on sale. So if you haven't gotten your teas book for quick facts, then you definitely will be able to get that during Black Friday. And the price will be super awesome. I guarantee you'll love the price, right? So, let's do our Monday motivation, and I promise I'll get back to the questions about the program, okay? So Marie says, thank God I did it. Yes. All right. So our motivation is after you make the right decision, and this is specifically for those who are saying yes to Remar. People are saying yes to Remar every day, and so many people said yes to that DVD package. They wanted to do the right thing for themselves. So now what? Now what? And Mark said this was a very personal motivation, even for myself, working on the follow through. And I love it. So when we're talking about following through, it is now like everybody says, I want to pass NCLEX. I want to pass NCLEX. But how do you create an environment to follow through on supporting that goal? Because if you don't have the right environment in order to follow through, then that goal is not going to be accomplished. It's not going to happen for you. Okay. I think that having a commitment device, that's the new name that I'm giving to these DVDs, right? So having a commitment device like you guys have the program, you've been studying with me, you know that this book is where you need to be studying from. This is your commitment device here. Having a right device, having a right program, having these calendars, okay? And I'm speaking to you guys who bought the package. When you get this book, when you get your Quick Facts book, it's going to have a calendar. When you get your student workbook in here, student workbook, it's going to have, is this the one? It's going to have a calendar in it. You have to have the commitment to the follow through. Some people will buy these packages and they will sit on the student's desk for months and they won't ever get started. Or they'll open it up, they'll read the first couple pages of Quick Facts, and then they will totally give up. They'll totally give up. So I need you guys to create an environment of follow through. So for me, that does mean a schedule. For you, that should mean a schedule when you know that you have set times that you're going to study. This package that you guys have literally will change your life. You will be nurses. You won't have to work where you're working. You'll have access to greater things. And that's what we want for you here. But you have to do the follow through. You have to commit to it. So create an environment of follow through, whether that's one with a calendar, whether that's you taking time off, that's you focusing on one material source. That environment has to be set right. Okay. All right. I know I'm getting a lot of true that. Commit to a concrete plan. That's tough for some people too. We're talking about how to follow through. What is your plan? What is your plan? And it's really simple to quantify it. I'm studying 2.5 to 3 hours a day, 4 to 5 days a week. That should be everybody's plan. It really does not take you being in the library morning to night. It doesn't take that. Okay. It takes focused, dedicated time. When we say that it's a 6-week process, it's a 6-week process if you have consistency. It's a 6-week process if you push past the resistance of, I don't feel like doing it. A lot of times our feelings are what keep us from success, especially when it comes to this NCLEX. We don't feel smart enough. We feel anxious. We have anxiety. We go into the exam feeling defeated. We study feeling defeated. We've taken some wrong advice. We've taken some bad advice. And so all the time, our feelings are guiding us when it shouldn't be our feelings. It should be the principles. It should be the sacrifices, what we're working for, our motivators, our children, our spouses, our mothers, our family that are depending on us. That's what should be guiding us to have the peace that we can pass this test. You can, you will, you must, but you got to get out of your feelings, and you have to have a commitment device, right? And so I renamed the program, but honestly, that's what it is created to do. Most people spend money on things they think will help them. I honestly don't feel like you guys are spending money just to be spending money. I don't think that. I honestly don't think that you guys, I think that you guys have to put a lot of trust into a company. And I'll just say this. When you purchase a company's products, you have to trust them to a point where you're exchanging money for their products. And I know at Remar, we do things a little bit differently because when you talk about commitment and follow through, I feel like that should be a two-way street. So just as you guys are committed to choosing a company, I feel like that company should be committed to you and following through with you. So it's very easy as a business to just take people's money and give them something and never hear from them again. That's easy business. Okay. If we just wanted to sell you guys questions, we could do that. We could sell you guys a question bank, say, here's 2,000 questions. Go ahead, have at them. All the best to you in your NCLEX. And we would make a lot of money probably doing that. But here, we want to make sure that we're giving you guys the best and what you actually need. Okay? So before you do questions, I got to make sure you have the content. I can't just give you guys questions. We got to make sure that what we're giving you is what's really going to help. I have to sleep at night. I can't sleep at night knowing that I just said, here's this, good luck to you, right? And so I'm here every week with you guys. I'm showing you that follow-up and consistency breeds results. I'm showing you that other people who were in your situation last week are no longer there because they didn't give up. That's what follow through and consistency looks like. It's me every Monday, 4 seasons a year, right here with you guys. Every Monday, whether I'm in Jamaica, whether I'm in wherever I am, I'm showing you guys that you have to be able to be committed to your word. You say you want to pass NCLEX, your actions have to reflect that you want to pass NCLEX. actions without no follow through is just words. It's just words. So we're talking about it here. Consult your commitment device. Consult it. Okay? Consult it. Don't just be giving away your time. Don't just be giving away your money. Don't just be giving away your hopes. Let it be grounded on something. Okay? All right. And you got to watch out for these pitfalls when we talk about following through, because, you know, we are our biggest enemy. We are our biggest enemy. Your brain is going to prioritize those immediate rewards. Passing NCLEX, I remember I said this before, passing NCLEX is a future goal. It's a future goal for most of us. So our brain is going to say, hey, yes, we could pass NCLEX and we're going to have a good time when we do that. But right now, there's a new movie on Netflix and we can enjoy that movie right now. And your brain is going to say, right now, there's something happening on Instagram that you would enjoy seeing. Or right now, you know, your friends are going out. You're going to have a great time if you go out with them right now. NCLEX will wait. So our brain loves to prioritize immediate goals. And that's why we could be sitting in front of chocolate cake, knowing we don't need the chocolate cake. We need to exercise. We need to lose weight, whatever. And we'll eat the chocolate cake because the gratification is immediate instead of us having to wait to work out to lose the weight over time. And so we have to be very careful about understanding that NCLEX, you get gratified through the studying. We have to find out that it feels good to study and at the end of your study session, feel like you've learned something. That's the gratification that we're looking for. That's how immediate gratification with NCLEX works. All right. Passing is great. But today we learned about what propylthiouracil, we learned about beta agonists. We talked about anti-anxiety and benzodiazepines. That's our immediate reward for today. Passing NCLEX will come as well, right? So remember also, I think that you've already done the hardest part. Oh my goodness. You've already done the hardest part. And I think that we have to remember that nursing school is hard. Nursing school was very hard. Getting into nursing school, getting through the graduation, that's hard. But also for some of us, it's even hard to get started. Getting started was the hardest one. Poof. Picking a program, deciding I'm going to do this or deciding I'm going to do this again, that's harder than actually carrying out the day-to-day studying. So many people are still just like, am I going to do this? Am I not going to do this? Do I want to try this again? Or am I just cool working at Walmart? Remember the nurse we had working at Walmart? So this is what we're talking about. The follow through today. I'm trying to remind you guys, the follow through is where the success happens, the consistency and the follow through. I like this. Angelisa says, please listen to Regina. I took NCLEX RN 5 times using many different products. And finally, I used her self-study and quick facts, passed with 75 questions. Hard work and dedication pays off. Pow. You can do it. You can do it. Love that. Thank you so much. Okay, so basically, bottom line, Remar nurses, your words are meaningless without intent and follow through. Okay, don't tell me or anybody else you're going to pass if you don't have the follow through, if you don't have the faith, if you don't have intentions to do the work. If you don't have it, don't say it. Okay, bottom line, that's Monday motivation for everybody, including myself. Okay. All right. So once again, Black Friday, you guys got to sign up now. What time does Black Friday start? You're going to be surprised. You're going to be surprised. Listen, I'm just going to tell you, be ready from the time that you wake up in the morning, be ready for Black Friday. You're going to get the agenda with the topics that we're going to go over. Just know the date and know to stay ready. From the rest of the month, we are staying ready. We're Black today. We're ready for Black Friday. Every time I pop on here, and I'm going to do pop-up sessions, Fridays, Wednesdays. I'm just going to come on and be like, are you ready for Black Friday? We're going over this, and this. So sign up at remarnurse.com. Black Friday. This will be an opportunity for us to do the live NCLEX review the day after you have spent time with your family. Listen, I could do this on Thanksgiving, but I'm being nice. That's how important it is. So you're going to spend time with your family that Thursday. You're going to have a great time. And then you are going to, the next day, you are going to spend it with your Remar family. Literally, there's probably going to be like 2,000 of us, 1,500 of us. Hey, Mark, so they'll be able to sign up. People are on the site now. They're looking for it. Mark is putting it up as we speak, the Black Friday NCLEX review. All right. Black Friday NCLEX review. You will be able to sign up for it. Thumbs up. Okay. All right. So how long will the video stay up after Black Friday? That's always the question. Honestly, I don't know. I can't tell you guys. I don't know how long it'll stay up. We will be doing it on Facebook and YouTube. We will be doing it on Facebook and YouTube. So you will be able to see it. Somebody says, I love last year's Black Friday. You loved last year's Black Friday. Oh my goodness. I'm not going to get on you. Last year's Black Friday is going to be, last year's Black Friday, I think is going to be, it's going to be better than last year's Black Friday. Let me just say that. It'll be better than last year's Black Friday. And last year's Black Friday was great. It was great. So I definitely want to see you guys all there. I want to see hundreds of people. I can't wait to talk to you and kind of just see what you guys are thinking. Monique says I passed NCLEX, so she won't be there for Black Friday. But we thank you so much for coming back and telling us about it. Woohoo, Monique, amazing. She's a top fan at Remar. So again, hey, Black Friday is coming. The live NCLEX review, the one that you hear all great things about. It will be PN to RN, PN to RN. Here we go. All right, watch on YouTube, subscribe, give this video a big thumbs up. We want more people to know about our Remar family as well. Listen, if you have questions, a lot of you guys have questions, comments, prayer reports, praise, testimonials, which package is best for me in all things Remar, support@remarreview.com. That is the email address. And we would love to have you on board for our prayer list or whatever else that you may need. Okay. 1-855-625-3966. If you are having questions about ordering, somebody says, I don't see the discount. There aren't any more. Again, just so we're clear, if you call 855-625-3966 and you ask for the PN package, we do not have any more of these PN packages available to you guys. We thank you so much for everybody that got them during the DVD clearance sale and who participated and committed. But we are saying goodbye to the DVD package. Okay. So those of you who have it, you are now owners of it. It's yours. It's yours. Also, the RN, we do have a few more RN packages available if you haven't made the investment. And then Mark even kept the sale going. So the package is still $169 while supplies last. So again, if you're calling 855-625-3966, we don't have the PN DVDs anymore. Okay. But we will have definitely support for you guys moving forward. Okay. So the Black Friday review will be for RNs and PNs. So feel free to join if you're a PN. Also, if you're an RN, you're going to find it very helpful, especially for my Remar nurses that are testing in December who have the package now. In about 3 or 4 weeks, you're getting ready to test for NCLEX. So we'll be going over the quick facts book. And also I'm going to do it just like I usually do it. When you sign up, you're going to get the agenda for the day. You'll also get your workbook. And then a lot of people have questions about, what we're working on now and any new products that we'll be releasing. We're going to put that in the Black Friday workbook. So all of your questions will be answered there, and you'll be able to know that, hey, this is a place that will help me to pass. This is a place that will help me to pass NCLEX. All right. So I'm reading all the comments and things like that. Okay. Also, hey, share this video. I wanted to make sure, share this video on Facebook, because you can, you will, and you must pass NCLEX. I am so grateful to have worked with you guys today, and I am so happy that, hey, I'm so happy that I'm getting testimonials as we speak. And I'm looking, so Rose says, hi, Regina. When I was looking for a review program, I always saw you giving motivations and explaining the content so clearly and to the point. I chose the online academy, the OLA, last 4th of July. And I'm so happy that I did. As an international trained nurse, more than 20 years out of nursing school, Remar helped me to pass 76 questions on the second attempt. Thanks to you and your team. No, thank you so much, Rose. Thank you for coming on here. Rose is a top fan here. I see it. She has the badge. So thank you so much for coming and saying that. Is it necessary for someone still in school? Please let me know. Let me tell you something. If you really want to give yourself an advantage in nursing school, and you guys can back me up on this, or you can agree or disagree, but I think that doing my NCLEX review will 100% give you an advantage in nursing school. Is there anybody on here who has done the review program or who's doing the review program and say, I wish I would have did this in nursing school? Because I 100% think that if you did my review program where I go over maternity, delegation, prioritization, everybody's like, yes, I agree. I'm telling you, your teachers would be shocked at your responses and your comprehension, because we learn in nursing school. I think one of the problems is we learn nursing school in pieces. So we may study one subject, and then the next semester we're studying a whole nother subject, and then we're studying a whole nother subject. And we tend to forget things along the way. But with my NCLEX review, I'm building on principles, so that at the end of the review, you literally can look at somebody and you can say, okay, I understand what's happening to this patient. And I understand that even though the doctors may be saying they have a heart problem, I know that the kidneys are involved. I know what medications should be administered. And I know how to think past the clinical symptoms and get to the root of the problem. That's one of the biggest advantages of having an NCLEX review with me, is that my intention is for you to have a big picture of nursing and not just know facts. I want you to be confident. And I think one of the great things about the way that I learned, if you guys know, I started nursing when I was 16, taking care of my grandparents. One of the biggest advantages I think that I had was how the nurse taught me as a teenager, as a child, right? How she taught me despite me not being in nursing school. And so when I teach you guys, I'm coming from that same perspective, whereas I don't have to make things complicated in order for you to learn it correctly, okay? And that's one of the advantages, I think, of doing the Remar review while you're still in nursing school, because it will help you tremendously get out of nursing school, pass those exit exams, and then you'll be even more prepared to sit for NCLEX. And so I see a lot of people saying, yes, absolutely. This would have been a blessing while in nursing school. Yes. I wish I had this in nursing school, definitely. And so we're definitely trying to be ambassadors to nursing school and nursing programs, and just show them that if you really want your students to be successful and not even just pass NCLEX, but be very great, competently trained nurses, NCLEX review is the best way to go, because NCLEX is all about client safety, and it's about using our practice of nursing to determine what the standard should be, okay? So your school might be testing you on 10 different things that are not the standard for NCLEX. Okay. So that's what I have to say about that. That was a great question. Can I use it still while you're in school? So you can. And even if you don't want to do the full program right now because you just want to focus on school, get quick facts. All right. Get quick facts. So those of you asking about your products, they are coming out. We literally got hundreds of orders when we did this sale. People are asking, hey, yes, the RN DVDs and the PN DVDs will no longer be available. So people jumped on the sale. So we literally are trying to get out as many orders as we can. Please be patient with us. If you haven't gotten a tracking number, it is coming. I promise you, it is coming. So Sam, you guys know Sam, he's working extremely hard, making sure that all the orders that are going to Nigeria and Saudi Arabia and Dubai and Florida and Tennessee and Atlanta are all going to get there. Okay. I promise we don't want to keep these packages in the Remar office. We want you guys to have them. All right. So where do we register? Check remarnurse.com. Check remarnurse.com for the sign up for Black Friday. Mark is working very hard on it. So I know a lot of you guys are rushing there now. If you don't see it, just give us a couple minutes and he'll get that link up. All right. So yes. Don't be discouraged. You guys can do it. Philly in the house, Florida in the house. Everyone is here. Philippines, Puerto Rico. I am really, really excited that you are able to find the Remar community, study with us every Monday. This is what we do. We just encourage and motivate you and review NCLEX to make sure that you're on the right path. There is a lot of information out there about how to be successful for NCLEX. And I want you guys to be able to come to one place and hear the truth. Most people only study for NCLEX and take NCLEX one time. And then after that, they forget it. They don't think about it anymore. This is literally what I do every day. Every day I have studied. I have dedicated myself to studying for NCLEX. Last night, I was studying for NCLEX, preparing for this Monday motivation. And I was reading about, what was I reading about? I was reading about management of care. And so I'm putting in prioritization questions and trying to come up with difficult and challenging prioritization questions for you guys. And I thought to myself, I don't know of any other nurse that is doing this to themselves every day and putting themselves through this. But I'm doing it for you guys because I want you to be experts in nursing and I want you to be experts in NCLEX. And so I have to be consistent and I have to follow through. So I'm telling you guys to follow through today. So once again, we like to say this: I can, I will, I must pass NCLEX. I can, I will, I must